Now, let's talk about the different professionals within the clinical laboratory. So, ano ba yung mga different positions that you can encounter in the clinical lab and their different responsibilities? So, first is the organizational chart. So, ang org chart natin nagkisimula yan sa top management, which is the hospital administrator. So, ito yung mga may-ari ng ospital together with the medical director. And then, under them, under the hospital admin will be the lab director or otherwise known as the department head. So, kapag lab director, he is the one overall in charge of the laboratory department. Okay, so kapag lab department, meron tayong isang tao, usually it is a doctor, pathologist, and that lab director is the one in charge of the whole laboratory. And then under the lab director, meron pa siya mga different chief of different sections, also known as the associate pathologist. So again yung lab director, pathologist din siya. Kapag pathologist, isa siyang doctor, medical doctor, specializing in laboratory medicine. Okay? And also in cancer diagnosis. Kaya tinawag siyang pathologist. So, yung pathologist na yan, siya yung head of the lab. Siya yung tinatawag natin na lab director. And then under the lab director, meron pang associate pathologist na meron kanya-kanyang area. For example, meron kang pathologist for microbiology. Meron kang associate pathologist for clinical chemistry. You also have one for hematology, for immunology and serology, for parasitology, for analysis of urine, okay, and also for histopathology. So, kung ilan yung section na meron ka sa laboratory mo, dapat meron kang pathologist na head ng mga section na yon. Okay? And then, under the associate pathologist is the chief medical technologist. So, going back to the associate pathologist, ano ba yung role ng mga associate pato sa mga different section in the laboratory? So, meron kang associate pathologist for supervisory need. Kasi, yung associate pathologist na yon, siya yung supervisor mismo nung isang section na yon. Now, so responsible siya pagdating sa mga results, sa pag-release ng result. So, lahat ng result under that section dadaan doon sa associate pato. So, for example, yung clinical chem, di ba, sa chemistry, yung mga blood sugar. Okay? So, bago ka mag-release ng result ng blood sugar, na-check na yan ng RMT, na-check ng Chief MedTech, and then yung last check will be the associate pathologist assigned for the clinical chemistry. Bakit kailangan pa siyang i-check ng pato? Kasi, so nga nasabi ko kanina, kapag pathologist, sila yung mga medical doctor specializing in laboratory medicine. So, kung merong hindi nakita si MedTech at hindi rin nakita ni Chief MedTech, dapat makita ni associate pathologist bago i-release ang resulta sa mga pasyente at sa doktor. Okay? Just in case merong mga discrepancy sa mga results. So, importante yon, kailangan i-check. Ang final check sa mga results before releasing should be the associate pathologist. Yun ang kanilang trabaho, yun ang kanilang responsibility. And then, let's say, nakita ng associate pato, mukhang may problema sa result na yan, mukhang hindi tally yung results nyo sa sugar, o kaya napansin ng associate pato, parang buo maghapon, puro matataas ang blood sugar na results natin. Okay? Then, maybe there is something wrong. Then, ito na yung time na si Chief MedTech, sasabihan niya, yung mga medtech under the clinical chem to please check your quality control. Please check this. Please check that. Para matrace natin kung yung mga results ba na nilalabas pa rin ay tama. So, yun ang importance kung bakit meron tayo tinatawag na associate pathologist. Okay? And then, under the associate pathologist will be the chief medical technologist. You know, class, ang chief medtech talaga, ang number one role ng chief medtech is actually quality control. So, kapag quality control, it means that the chief medtech should check all sections under the clinical lab if the machines are actually performing well. So, tama ba yung performance ng mga machine? Tama ba yung tinatawag natin ng mga quality control check? Okay? So, ang responsible dyan will be chief medical technologist. So, when you say quality control, ito yung practice na ginagawa sa laboratory to make sure that all of the results are actually accurate. Okay, accurate yan and precise. So, merong mga different tests na ginagawa ang mga METIC sa mga machine para malaman nila kung talaga ba na accurate pa yung mga results. Okay? And then, the one person who will check the accuracy of the results, or the performance of the machine is the Chief Medical Technologist. Yun talaga ang trabaho ng Chief MedTech. But here in the Philippines, iba kasi yung setup talaga here in the Philippines. Kasi nga naman, mahirap lang na bansa. Ang nangyayari tuloy kay Chief MedTech is siya na rin yung nagiging lab manager. Which is actually not the role of a Chief MedTech. Hindi talaga ganun ang trabaho ng Chief MedTech. Kapag nag-work ka sa ibang bansa at naging Chief MedTech ka, dun ka lang talaga sa mga quality control check. Tinitingnan mo, you're the one responsible, you're the one supervising if the machines are working properly, if the quality control results are good, if all of the results are actually accurate and precise. Yun ang number one responsibility mo. Kaya nga tinawag na Chief Medical Technologist. But here in the Philippines, kapag Chief Medic ka, ikaw na rin yung manager ng lab. Ikaw yung boss ng lab, which is actually not like that. Hindi talaga dapat ganun ang setup. Okay, but we're in the Philippines, kaya nga naman sa Pilipinas, ganun ang dadatnan nyo. So, kapag nag-work ka sa lab, makikita mo, yung Chief Medic, siya yung boss. Siya yung boss ng lab. So, siya yung responsible sa mga budget, sa mga supply requisition, siya yung responsible sa pagkuha ng mga gamit, yung mga reagents na kailangan ng mga machine. More on managerial ang ginagawa ng isang Chief Medic dito sa Philippines. Which is very sad kasi hindi naman talaga dapat ganon. So, sino ba talaga dapat yung in charge sa mga sa mga managerial position? Dapat laboratory manager. Dapat meron ka pang lab manager, which is yun ang missing sa mga lab sa Philippines. So, ang meron lang tayo sa mga lab natin, Chief MedTech, kasi siya na rin yung manager. Okay? And then, after ng Chief MedTech, meron kang Assistant Chief MedTech. So, same lang naman ng kanilang work. Okay? So, dalawa sila na in charge sa quality control. And then, under the Chief MedTech, kada section, meron ka tinatawag na section head. So, under different laboratory sections, you have a section head. Yung section head, siya yung in charge sa overall process in that section. For example, sa hematology. So, sa hematology, meron kang isang section head, and then you also have the medical technology staff. So, kapag medical technology staff ka, ikaw yung gumagawa ng mga tests sa hema. So, ikaw yung gumagawa ng CBC, you're the one collecting the blood sample, you are the one processing the blood, gumagawa ka ng blood smear, and then, ano pa ba? You perform complete blood count and other hematological tests. Yun ang tinatawag natin na medical technology staff. Otherwise known as, sa ibang bansa, ang tawag sa'yo is generalist. Okay? Okay? So, ganun siya. So, kapag generalist ka, ibig sabihin noon, you can actually rotate sa different sections in the laboratory. So, pwede kang mag-work sa HEMA, sa microbio, clinical chem, blood bank, etc. So, ikaw yung rotating staff ng HEMA and other section. Pero, sa HEMA, meron kang isang tao, one person, called as the section head. Yung section head, permanent siya sa hematology. Hindi siya aalis doon. Siya yung in charge sa overall process ng hematology. So, siya yung magsasabi kung sino yung tao in charge sa processing ng blood, sino yung tao in charge sa CBC, sino yung tao in charge sa pagkuha ng blood sample. So, kumbaga, kada isang section, meron kang isang boss. Okay? Which is the section head. So, ganun din. Sa microbio, meron ka ring section head. Sa clinical chem, you have the section head. Blood bank, section head. Sa immunosero, section head. Clinical microscopy, section head. Histopath, section head. Okay? So, meron kang tig-iisa na section head. And then, under nung section head, meron sila mga staff. So, different setting kasi sa Philippines eh. Iba't iba. Wala kasi talagang standard setup dito. So, may mga ospital na kapag assign ka sa hematology, doon ka na talaga. Kumbaga, meron doong permanent staff, which is the section head, plus permanent staff, which is the one that will do the bench work. So, meron ka talagang isang grupo ng mga medic na under lang ng hematology. Doon lang sila. Hindi sila aalis. Okay? Pero, ang pinaka-common na setup kasi talaga sa Philippines, since tipid sa tao, mahirap na bansa, and then kulang kasi ang mga medtech sa Philippines, kulang ang nag-aaral ng medical course, di ba? So, ang nangyayari dyan, sa isang lab na malaki, kada isang section, meron kang permanent na section head. And then, yung mga staff na medtech, rotating. Kunwari, ikaw, junior staff ka, bago ka pala na medtech, ngayong week na ito sa hematology ka, tas next week doon ka sa microbio, next week doon ka sa clinical chem, umiikot ka. So, marami tayong tinatawag na generalist dito. Kasi kapag generalist, lahat kaya mong ikutan eh. Okay? So, yun ang setup in the Philippines talaga. Umiikot yung mga medtech. Pero sa ibang bansa, dapat talaga isang section lang. Bakit? Kasi yung mga medtech, nagkakaroon sila ng mastery, nagkakaroon sila ng specialization. So, example, ilang taon ka nang tatrabaho sa hema. So, kunwari, 4 na taon ka na sa hematology, malamang ikaw na yung expert sa hematology. 'Di ba? 4 na taon ka na dun eh. So, alam mo na. So, nagkakaroon ka ng mastery. So, in the Philippines, bakit kaya ang hirap gawin yun? Bakit kaya walang ganong setup or konti lang ang ganong setup? Kasi sa Philippines, maraming medtech na umaalis. So, konti na nga yung staff, aalis pa yung mga medtech nag-abroad. Kaya nga naman, commonly talaga, rotating yung mga medtech. They rotate kasi nga kulang ng staff. Okay? So, ganun yung nangyayari in the Philippines. But, in a perfect setting sa textbook setting, dapat talaga, sa different section, meron kang section head plus the staff dedicated to that section. So, kung part ka ng hema, dapat sa hema ka lang. Kung part ka ng micro, sa micro ka lang. Kung staff ka ng clinical chem, doon ka lang sa clinical chem, etc. Okay? But in the Philippines, hindi siya nangyayari. So, after that, medical technology supervisor, different sections. So, sabi ko nga, itong mga supervisor of different sections, sila yung tinatawag na section head. So, under nila is the staff medical technologist. Ito yung sinabi ko kanina na pwedeng rotating or permanent sa isang section. And then, under the staff medical technologist will be the laboratory technician. So, ano ba yung mga lab technician? When you say lab technician, sila yung mga medtech din yan. Graduate sila ng medtech, pero hindi sila nakapag-take ng board exam or hindi sila pumasa sa board exam. Yun ang difference ng staff sa technician. Kapag staff ka ng medtech, ibig sabihin noon, ikaw ay RMT, you are a licensed medical technologist. You're able to graduate and then you're able to pass the board exam. You have a license to practice. So, yung mga laboratory technician naman, yes, there are graduate of medical technology. However, they are not able to get their license. So, pwedeng di sila pumasa sa board exam or talagang hindi lang talaga sila kumuha ng license. Okay? So, yun yung mga lab tech. So, ano naman trabaho ng lab tech? Ang lab tech, sila yung inuutusan sa laboratory. For example, sa section ng urinalysis. So, after mag-process ng staff medtech na mga urine, si lab tech, papasok siya, kukunin niya lahat ng mga urine at tae, yung mga stool, di ba? Mga stool tsaka urine, kukunin ni lab tech, siya ang bahala sa disposal. So, gagawin ni lab tech, lahat ng mga urine na yun, na nasa urine cup, isa-isa niyang bubuksan, i-flush niya sa toilet. Okay? And then, yung mga stool, babalutin niya, itatapon niya properly. And then, kunyari sa hematology naman, anong ginagawa ni lab tech sa hema? So, kunyari, yung mga test tube na may mga blood, di ba? So, yung mga ibang test tube doon na pwede pang gamitin, hinuhugasan ni lab tech. Kumbaga, yung lab tech, siya yung naghuhugas sa lab, siya yung nagdi-dispose ng mga basura ng lab. Yun ang ginagawa ni lab tech. And then, minsan, siya rin yung in charge sa releasing na result. Siya yung nagdadala ng mga results sa ward. Okay? So, dapat maging license kayo. Kasi kung hindi kayo license, ganun na magiging trabaho nyo. Uutusan talaga kayo ng staff. Okay? So, yun. Yun ang nagiging work ng mga lab technician. Another thing is the laboratory nurse. So, minsan, meron tayong lab nurse, pero hindi lahat meron. Ano ba ang purpose ng laboratory nurse na yan? So, kailangan din sila sa blood bank. Kasi diba nga sabi ko last time, meron tayong blood bank section. So, sa blood bank, ito yung area kung saan kumukuha ka ng mga blood unit for transfusion sa patient. And then, yung mga laboratory nurse na yan, sila yung in charge sa blood bank pagdating sa screening of blood donors. Kasi nga naman, a blood donor must be screened if the blood donor is actually healthy. So the lab nurse will check the vital signs of the donor, and the lab nurse will check the weight of the donor, the height, and the overall appearance of the donor. And then the lab nurse will also interview the donor. So pagdating sa mga donor screening, lab nurse ang gumagawa niyaan. Okay? And then of course, meron pa tayong laboratory aid. So yung laboratory aid natin, hindi sila necessarily na graduate ng medtech. So graduate sila ng medical profession, pero yung kanilang job is actually to help the lab tech. Okay, so yun yung mga lab 8 natin. Naghuhugas din sila, naghuhugas. They also dispose waste. Sila rin in charge sa mga disposal ng mga lab waste natin. And then they also help in releasing the results. Okay, so sila yung magkakasama ng lab technician and lab 8. Okay? So, sino ba yung mga personnel sa laboratory? Sabi ko nga kanina, meron ka lab director. So, kapag lab director ka, dapat ikaw ay pathologist. Dapat certified ka ng Philippine Society of Pathology. So, hindi lahat ng pathologist pwede maging lab director. Okay? So, basta, dapat certified ka pa ng Philippine Society of Pathologists. So, again, there are pwede rin ang medical doctors, doctoral scientists, doctor of osteopathy. They are the one who has ultimate responsibility for all laboratory operations. So, yung lab director na yan, may nakalagay dito na iba pang practice eh. Medical doctors daw, and of course, kapag pathologist, doctor ka rin naman, di ba? Doctoral scientist, doctor of osteopathy. Sa ibang bansa kasi, they allow this one, pinapayagan na yung mga doctoral scientists, doctors of osteopathy, they're allowed to become laboratory director. But in the Philippines kasi, based sa ating batas, dapat kapag lab director ka, ikaw ay pathologist. So, tapos ka ng pathology, and then, certified ka ng Philippine Society of Pathologists. And then, for the medical personnel, so sabi ko nga kanina, dapat meron ka pang lab manager. Diba? But in the Philippines, ang trabaho ng lab manager tsaka trabaho ng chief medtech all in one. Kaya kawawa si chief medtech. So, si lab manager, anong ginagawa niya? So, educated din siya, someone educated in the lab sciences and with additional business or management training. Okay, so medtech ka rin, pero meron ka mga business or management experience or training. Kasi nga naman, ikaw responsible pagdating doon sa finances ng lab, management of the whole laboratory. Okay, so you're responsible for setting personal standards, establish training and evaluation procedure, establish appropriate quality control program, and observe and document the employee performance and competence. So, basta may kinalaman sa management, ikaw dapat yon. Kaya nga tinawag kang laboratory manager. So, next is the general supervisor or the department head. So, for this one, they are responsible for the quantity and quality of work performed in his or her department, responsible for training employees, and for evaluating employee performance. So, yung general supervisor na yan, or the department head, sabi ko nga kanina, pathologist din yan, di ba? It is the doctor, right? Ikaw yung head mismo ng lab. Ikaw yung pato. So, in the Philippines, ang requirement dapat pathologist ka. So, they are responsible for the quantity and quality of work performed in the department. Okay? Kaya nga naman you're able to check yung mga results. Kung tama ba yung mga results na nilalabas. Then after that, you have the testing personnel or the bench technologists. So, ito yung mga medtech, diba, that performs the laboratory test. Ang tawag sa'yo, testing personnel or bench technologist. So, ano bang qualifications of a medical technologist or ACLS? Sabi ko nga, dapat ikaw ay tapos ng BS of Medical Technology. And then, you're able to complete a training. Yung training program na yan, ito yung tinatawag natin na internship program. So, pagdating nyo ng 4th year, you will be interns. You will be assigned in a hospital. Then, you're going to rotate in those hospital for 1 year. Dalawang rotation yon, 6 months sa isang hospital, another 6 months to another hospital. And then, individuals must also pass the national examination. So, in the Philippines, meron tayong PRC, di ba? PRC licensure exam. Now, again, meron ka ring medical lab technician or the laboratory technician. So, you will assist the meeting the performance of different laboratory assay. For the phlebotomist naman, yan, meron kasing mga, yung mga phlebotomist na yan, pwede kasi na hindi sila license. Pwede na hindi sila RMT. Kumbaga, nag-train sila ng phlebotomy. And then, ang kanilang ginagawa lang is blood extraction. So, napaka-broad kapag tinawag na phlebotomist eh. Yung mga phlebotomist kasi, pwede rin na nurses yan. Pwedeng medtech na hindi RMT, nag-training ng phlebotomy, or mga nurse na nag-train talaga ng phlebotomy. Pwede rin. So, ang ginagawa lang nila, doon lang sila sa blood extraction area, kumukuha lang sila ng dugo. Yun ang kanilang trabaho. Pero hindi lahat ganun ng setup in the Philippines. So, ano ba ang qualities ng isang medical laboratory professional? So, first, you must be dedicated sa work. You must be able to cooperate. And importante yung neatness talaga. So, dapat malinis ka kasi nga, you are a healthcare professional. You have a caring attitude, physical stamina. Yan, physical stamina kasi nakakapagod ang work. You will move a lot. You will actually, you will go to different ward. Nag-ward ka. And then you're going to collect the sample of the patients. And then, after mo pumunta sa mga ward, babalik ka sa lab to process the sample. So, dapat meron kang good physical health or physical stamina. Of course, good eyesight. Kasi nga naman, di ba, we always look under the microscope. And then normal color vision, very important yan because there are some tests that we rely on the different colors pagdating sa mga interpretation or result. Like positive purple or yellow negative, positive red, etc. May mga ganun tayong mga test na ginagawa. Manual dexterity, good intellect, of course, diba? And aptitude in biological science and communication skills and honesty. So, importante rin yung communication skills in terms of giving instructions to patients. Kasi nga naman, kung hindi ka magaling makipag-communicate sa pasyente, yung pasyente will not be able to understand you. So, importante yon pagdating sa pagbibigay ng mga instructions sa pasyente. So, in terms of ethics and professionalism, So, pagdating sa international, you have your American Association of Clinical Laboratory Science, ASCLS, formerly known as the ASMT or the Association or the American Society for Medical Technology. So, sila yung responsible to maintain the ethics and professionalism of medical technologists. However, here in the Philippines, ang meron tayo is the PRC Ethics Committee or the PAMET Ethics Committee rin. So, para saan ang ethics and professionalism? So, for example, meron tayong isang medtech na nagkamali siya sa release ng result, 'di ba? So, yung license mo, pwedeng bawiin ng PRC. Ibig sabihin noon, lumabag ka sa Code of Conduct or Code of Behavior ng mga professional medical technologists, and then may karapatan ng PRC na bawiin ang license mo. So, the one who will decide on that is actually the PRC Ethics Committee. Okay? Kaya nga naman, dapat maingat ka talaga sa trabaho mo kasi yung license mo na pinaghirapan mo, pwede rin siyang bawiin agad-agad ng PRC once nagkaroon ka ng criminal case. Another thing is the privacy and confidentiality. So, tandaan nyo, all patient information is confidential. So, kahit may pumasok pang artista sa laboratory nyo at kinuha mo siya ng dugo, and then yung test niya, for STD, di ba? Kunyari, may artista, nagpa-test sa laboratory mo, ang ginawang test, HIV test. Pagkakalat mo ba? Hindi. Hindi mo dapat ipagkalat yun. Kasi once kumalat yung chismis regarding sa artista na yun, pwede kanyang i-report sa PRC. So, ano yun? One condition yun para mawalan ka ng lisensya. Okay? So, meron tayong tinatawag na need to know basis lang. Sino lang ba yung dapat makaalam ng results ng pasyente? Malamang yung pasyente, di ba? The patient itself and the doctor. Sila lang talaga yung may karapatan sa mga results. So, test results should not be discussed with patients, their relatives, or other inappropriate person. So, once lumabas na yung result ng pasyente, nagtanong yung pasyente, Miss, ano ba yung result ko? Normal ba to or hindi? Anong gagawin mo? Hindi ka dapat kikibo. Ang sasabihin mo lang sa pasyente, Ma'am, sir, punta na lang po kayo sa doktor nyo. Yung doktor po yung magpapaliwanag. Kasi, hindi ka pwede talaga mag-explain ng result sa pasyente. Dahil hindi ka naman doktor. Ang pwede lang dyan is the medical doctors. So, test results should be reported only to the physician or the appropriate designated employee. The employee must be professional, courteous, and considerate of patients, and the laboratory analysis must be performed carefully and accurately using the best techniques available. Okay? Next. So, in a clinical laboratory, so ano ba ang clinical lab? A clinical lab is defined as a facility that perform chemical microscope examinations of various body fluid like blood and tissues. Okay? It is also a field where novelty plays a crucial role in sustaining health. So, yung mga laboratory niya, meron tayong different types of clinical laboratory. So, you can find them in the government and private hospital. Pwede rin yung mga freestanding lab. Kapag freestanding, ito yung mga lab na wala sa ospital. Ano bang example niyan? Yung mga nandyan, yung mga laboratory dyan sa tabi-tabi that offers tests, 'di ba? Sila yung mga freestanding. And then, pwede rin yung mga clinic found in, yung mga lab found in clinics, group practices, physician office, vet office, government agency, and military institution. So, ano ba yung classification of a clinical lab in the Philippines? So, itong discussion natin, Philippine setting to ha. So, first, it is classified based on ownership. Kapag ownership is the lab owned by a government or a private entity. Tulad na ng mga lab sa government hospital. And of course, lab sa private hospital. Another classification is classification by function. When you say by function, it is divided into the following. The first is clinical pathology. So, under ng clinical pathology, you have the following sections. You have clinical chemistry, hematology, immunohematology, microbiology, immunology, clinical microscopy, endocrinology, molecular biology, cytogenetics, toxicology, and therapeutic drug monitoring. So, these are all under clinical pathology. The other one is anatomic pathology. So, kapag anatomic pathology, meron siyang kinalaman sa mga tissues. So, ito yung nagko-process ng mga tissue ng mga tao, such as surgical pathology, immunohistopathology, cytology, autopsy, forensic pathology, and molecular pathology. So, lahat yung mga yan, aaralin nyo sa 4 na taon natin sa medtech. Okay? So, aralin nyo yan lahat, yung mga section na yan. Part yan ng ating mga lessons as you go along first year, second year, third year, eventually up to fourth year. Another one is classification by institutional character. So, when you say institution-based, ibig sabihin noon, it is under the wing of an institution. So, pwedeng under the hospital or inside the hospital, a lab in the medical clinic, lab in the school, lab in the medical facility for overseas workers and seafarers, birthing home, psychiatric facility, drug rehabilitation center. So, ito yung mga lab under an institution. Now, another one is the freestanding lab. Tulad nga ng sabi ko kanina, ito yung mga lab offering services na hindi siya connected sa mga hospital or any institution. Kaya tinawag siyang freestanding lab. So, it can also be classified by service capacity. So, under service capacity, number 1, you have the general clinical lab. So, kapag general clinical lab, so, meron ka tinatawag na primary category. So, primary category, it means, ito yung mga routine test na ginagawa. Okay? Yun ang under ng primary category. So, kapag primary, when you say routine, ito yung mga test na essential, na laging kailangan ng mga doktor for them to diagnose a disease. Tulad ng routine hema. Kapag routine hema, ito lang ang kailangan mo. Hemoglobin, RBC count, hematocrit, WBC count, and leukocyte diff count. Also, qualitative platelet determination. So, kapag qualitative platelet determination, you're just going to say if the platelet is increase or decrease or normal. Wala talaga siyang platelet count. Hindi mo binibilang yung actual number of platelets. Sasabihin mo lang, the platelet is normal, the platelet is decreased, the platelet is increased. Okay? Yun ang tinatawag na qualitative platelet determination. And of course, you have the routine urinalysis, routine fecalysis, and of course, blood typing. So, ito yung mga under ng primary category. Minimum service lang. Ito yung mga pinaka-basic lab tests usually na kailangan ng mga doktor. So, after the primary, you have the secondary category. So, secondary category, lahat ng services under the primary nandun, plus the following. Meron ka ng routine clinical chem. Ayan. So, kapag sinabi mo na routine clinical chem, you have blood glucose, BUN, uric acid, creatinine, total cholesterol determination. Yan yung mga tests under sa routine clinical chem. And of course, you now have the quantitative platelet. So yung platelet count, meron na. Binibilang mo na yung platelets. Cross-matching for hospital-based, gram staining for hospital-based, and potassium hydroxide test for hospital-based. So yung gram stain tsaka potassium hydroxide, pang microbiology yan. Ito yung mga tests for microbes, sa mga mikrobyo. Yung cross-matching naman, ito yung test para masabi natin na yung blood unit na isasalin sa pasyente is actually compatible. So, tinitignan mo na kung compatible ba yung blood unit bago isalin sa pasyente. Importante yon kasi kapag hindi compatible, pwedeng mamatay yung pasyente. And then, next is the tertiary category. So, for the tertiary category, lahat daw ng services na meron ang ang secondary plus the following. Again, kapag under ka ng tertiary category, meron ka ng services ng primary, secondary plus the following. Meron ka ng special chemistry. Okay? Special hematology. Kapag special hematology, coagulation test. Now, immunology, you now have that. The test for the antibodies and antigen. Microbiology, that deals with microbes, microbe culture, and microbes sensitivity testing. So, aerobic and anaerobic culture. Okay? So, this is for hospital-based or the non-hospital-based type. And then, the last is the limited service capability. So, kapag limited service capability, institution-based lang siya. Example of that, it can be found on the dialysis center and social hygiene clinic. So, kapag institution-based lang or limited service capacity, meron ka lang isang test na available. Kunwari, meron ka lang test, yung blood sugar. Kasi common talaga, kailangan ng blood sugar eh. Then, blood sugar lang meron. O kaya urinalysis lang, then urinalysis lang meron. Yun yung tinatawag natin na limited service capability. Now, the last one is the special clinical lab. When you say special clinical lab, it offers highly specialized lab services that are not usually provided by a general clinical lab. So, ano ba yung mga example ng mga special clinical lab? Yan, yung molecular biology, yung PCR test, di ba? So, hindi lahat ng ospital merong PCR. Kaya ngayong may pandemic tayo, hirap na hirap maghanap kung saan ba yung may mga PCR testing. And then ngayon pa lang, nagkakaroon ng wide capacity ng testing, di ba? Sabi nila, tumaas daw yung capacity ng testing kasi marami na tayo mga PCR test na ginagawa. Marami na mga molecular laboratory na ginagawa. Okay? So, yun ang example of a special clinical lab. Or the one that performs DNA testing, yung mga fertility test, yan, mga fertility testing sa mga hindi nanganganak, special lab din yan. Hindi lahat ng lab merong fertility lab. Okay? Yun ang example of the special clinical lab. So, that is the lesson.